This is the vertical clamp for weight loss surgery. It is a silicone-covered titanium-based clamp which is placed parallel to the lesser curvature and separates the stomach into a lateral excluded portion and a medial channel through which nutrients enter the distal stomach. The inferior portion of the clamp has a flexible wide opening through which the gastric juices from the excluded segment empty into the distal stomach. The inferior opening of the clamp is wide enough to allow passage of the gastroscope to allow endoscopic evaluation of the excluded segment of the stomach. The placement of this clamp requires no cutting, stapling, or change of the gastric anatomy. The clamp is reversible. The clamp is placed by creating an opening at the angle of His and by creating a window on the greater curvature directly inferior to the incisura angularis. An articulating dissector is then passed through a number 12 trocar through the window on the greater curvature posterior to the stomach towards the diaphragm. The dissector is passed to the left of the left gastric artery. It is then angled, allowing for the tip of the dissector to protrude at the angle of His. The dissector has a suture attached at its tip, with the other end of the suture attached to the floppy belt portion of the clamp. The suture is cut and separated from the articulating dissector, and the suture is then pulled out through a lateral trocar, while at the same time the clamp is pushed into the abdominal cavity through a number 12 trocar and placed posterior to the stomach. With pulling of the suture, the floppy belt portion should protrude at the angle of His, maintaining the posterior limb of the clamp underneath the stomach. The top limb of the clamp is now flipped onto the anterior surface of the stomach. The latch at the end of the top limb of the clamp is now placed through the lower opening in the floppy belt portion, closing the clamp in place. A bougie is now placed transorally into the stomach. With the bougie in place, the clamp sutured to the stomach, first posteriorly and then anteriorly. This is accomplished by passing a suture through titanium-rimmed openings that are easily identifiable on the clamp and then suturing the stomach. 3 sutures are used posteriorly and for anteriorly. An endoscope can then be passed at any time to examine the medial lumen and can also pass through the inferior clamp opening to examine the excluded segment of the stomach.